Hey everyone, welcome back to Native Speakers Channel. I'm Johnny, and I'm here with my good friend Sarah. How are you doing today, Sarah?
I'm doing great, Johnny. Thanks for having me. I'm really excited about today's topic.
Awesome. So today we're diving into something super practical and useful, essential pharmacy conversations you must know. Whether you're a pharmacy student, a healthcare professional, or just someone who wants to improve their English communication skills in medical settings, this episode is packed with real-world conversations that you'll actually use. Sarah, you've worked in healthcare for years, right?
That's right. I've spent a lot of time in clinical settings, and I can tell you that knowing how to communicate effectively in a pharmacy is absolutely crucial. These aren't just textbook phrases. These are real conversations that happen every single day.
Perfect. So let's jump right in and help our viewers master these essential pharmacy conversations. Conversation 1. Greeting a customer and offering assistance. All right, Sarah, let's start with the basics. When a customer walks into a pharmacy, what's the first interaction like?
Great question. The greeting sets the tone for the entire interaction. Let me show you a typical scenario. I'll be the pharmacist, and you can be the customer. Good morning. Welcome to Greenwood Pharmacy. How can I help you today?
Hi, I have a prescription that I need to fill.
Absolutely. I'd be happy to help you with that. May I have your prescription and a form of identification, please?
Sure, here you go.
Perfect, thank you. And can I confirm your full name and date of birth for our records?
Yes, it's Johnny Martinez, and my date of birth is March 15th, 1990.
Great, thank you, Mr. Martinez. Let me pull up your information in our system. I see you've been here before. Is your address still 456 Oak Street?
Yes, that's correct.
Wonderful. I'll get this prescription processed for you right away. It should take about 15 to 20 minutes. Would you like to wait, or would you prefer to come back later?
I'll wait, thank you.
No problem at all. Feel free to browse around the store, and I'll call your name when it's ready.
Okay, so Sarah, let's break this down for our viewers. What are the key phrases here?
Excellent idea. So first, we had, how can I help you today? This is a standard, polite opening. Then we have, may I have, which is a polite way to request something. Notice I didn't say, give me your ID. That would be too direct and potentially rude.
Right, and you also used, I'd be happy to help you with that. That's a really friendly, professional phrase.
Exactly. And confirming personal information is crucial for patient safety. We always say, can I confirm, or let me verify before asking for details. It's both professional and necessary for accuracy.
Conversation 2. Explaining medication instructions. Now, let's move on to something really important, explaining how to take medication. This is where clear communication can literally be life-saving, right, Sarah?
Absolutely. Miscommunication about medication can lead to serious problems. Let's do another role play. This time, you're the pharmacist and I'm the patient.
Sounds good. Let me get into character here. Ms. Henderson, your prescription is ready.
Oh, great. Thank you.
You're welcome. So today I'm giving you amoxicillin 500 milligrams. This is an antibiotic that your doctor prescribed for your bacterial infection. Have you taken this medication before?
No, I haven't. This is my first time.
No problem. Let me explain how to take it properly. You'll need to take 1 capsule 3 times a day. That means morning, afternoon, and evening for 10 days. You must complete the entire course, even if you start feeling better before the 10 days are up.
Okay, 3 times a day for 10 days. Got it. Should I take it with food?
Great question. Yes, I recommend taking it with food or milk to help prevent stomach upset. Try to space out the doses evenly throughout the day. So if you take the first one at 8 a.m., take the next one around 2 p.m., and the last one around 8 p.m.
That makes sense. Are there any side effects I should watch out for?
Good question. Some common side effects include mild nausea, diarrhea, or stomach discomfort. These are usually mild and go away on their own. However, if you develop a severe rash, difficulty breathing, or severe diarrhea, stop taking the medication immediately and contact your doctor or go to the emergency room.
Okay, I understand. Also, one more important thing. Avoid alcohol while taking this medication, as it can reduce its effectiveness and increase side effects. And if you're taking any other medications, especially birth control pills, let me know, because antibiotics can sometimes interfere with them.
I am on birth control, actually.
In that case, I'd recommend using backup contraceptive, like condoms, while you're on this antibiotic, and for 7 days after you finish it, just to be safe. You should also check with your doctor about this.
Thank you so much for letting me know. I wouldn't have thought of that.
You're very welcome. That's what we're here for. Do you have any other questions?
No, I think I'm all set. Thank you.
My pleasure. And remember, if you have any questions at all, even after you leave, don't hesitate to call us. We're here to help. I hope you feel better soon.
Thank you so much. Okay, Sarah, let's switch back. That was a really detailed explanation. What are the most important elements here?
Well, first, we always ask, have you taken this medication before? This helps us know how much explanation is needed. Then we break down the instructions into clear, simple steps: dosage, frequency, and duration.
And you noticed I used very specific language, 1 capsule 3 times a day for 10 days, not vague terms like take as needed or take regularly.
Exactly. And we always explain the why behind instructions, like complete the entire course even if you feel better. That helps patients understand it's not optional.
The side effects discussion is crucial, too. We mentioned common, mild side effects, but also the serious ones that require immediate medical attention.
Right. And we always end with, do you have any questions, to open the door for further communication. Patient education is our responsibility.
Conversation 3. Handling insurance issues. Now, let's talk about something that happens all the time but can be tricky: insurance problems. Sarah, I know this can be frustrating for both the pharmacist and the patient.
Oh, yes. Insurance issues are probably one of the most common challenges in pharmacy. Let me be the pharmacist this time, and you're a patient whose insurance isn't covering their medication. Mr. Johnson, I've processed your prescription, but I'm encountering an issue with your insurance coverage.
Oh no, what's wrong? I have insurance.
I understand your concern. Your insurance is active, but this particular medication isn't on your plan's formulary, which means it's not on the list of medications they cover. The cost without insurance would be $285.
What? That's way too expensive. I can't afford that. What are my options?
I completely understand, and I want to help you find a solution. We have several options. First, I can contact your doctor to request a prior authorization. This means your doctor would need to provide medical justification to your insurance company for why you need this specific medication.
How long does that take?
It typically takes 24 to 72 hours, sometimes up to a week, depending on the insurance company. I know that's not ideal if you need to start the medication right away.
Yeah, I really need to start it soon. What else can we do?
The second option is to ask your doctor if there's a generic alternative or a different medication in the same class that your insurance does cover. Generic medications are usually much more affordable and work just as well.
Okay, that sounds promising.
The third option is to look into manufacturer coupons or patient assistance programs. Many pharmaceutical companies offer discount cards or programs for patients who can't afford their medications. I can help you search for these.
Really? I didn't know that existed.
Yes. Also, we have a pharmacy discount program that might reduce the cost significantly. Let me check what the price would be with our discount card. She pretends to type on a computer. Okay, with our pharmacy discount program, I can get the price down to $95. It's still not as low as a typical copay, but it's much better than $285.
That's definitely more manageable, but is there any way to get it even lower?
Let me call your doctor's office right now to see if they can prescribe a generic alternative or a covered medication. Would you mind waiting a few minutes while I do that?
No, not at all. Thank you so much for trying to help me.
Of course, that's what I'm here for. Have a seat, and I'll let you know what I find out shortly.
Wow, Sarah, that was really comprehensive. You offered like 5 or 6 different solutions.
That's the key, Johnny. When there's an insurance problem, the worst thing you can do is just say, sorry, your insurance doesn't cover it, and leave the patient without options. We need to be problem solvers.
And you used really empathetic language. You said things like, I understand your concern, and I completely understand.
Yes, empathy is crucial. Patients are often stressed about their health and their finances. Acknowledging their feelings makes them feel heard and respected.
You also explained what a formulary is, what prior authorization means. You didn't just use jargon without explanation.
Exactly. And we can't assume patients understand insurance terminology. Breaking it down in simple terms is part of our job. And notice how I offered to call the doctor's office right away? Being proactive shows patients that we're on their side.
Let's move on to another common scenario, helping someone choose an over-the-counter medication. Sarah, this requires a different kind of conversation, doesn't it?
It does. With OTC medications, we're not just filling a prescription. We're actually making recommendations based on the person's symptoms and medical history. This requires careful questioning. You be the pharmacist this time, Johnny.
Got it. So let me set the scene. A customer approaches the counter, looking confused.
Excuse me, can you help me find something for a headache?
Of course, I'd be happy to help. Can I ask you a few questions first to make sure I recommend the best option for you?
Sure, no problem.
Great. How long have you been experiencing the headache?
It started this morning, so just a few hours.
Okay, and on a scale of 1 to 10, how would you rate the pain?
I'd say it's about a 6. It's pretty uncomfortable.
I understand. Is this a dull, throbbing pain, or is it sharp and intense?
It's more of a throbbing pain, especially around my temples.
Got it. Have you taken anything for it yet today?
No, not yet. I was hoping to come here first and get some advice.
That's smart. Now, do you have any allergies to medications or any medical conditions I should know about?
I have high blood pressure, and I take medication for it daily.
Thank you for telling me. That's important information. Are you currently taking any other medications, including vitamins or supplements?
Just my blood pressure medication, lisinopril I think it's called, and I take a daily multivitamin.
Perfect. And when was the last time you ate something?
I had breakfast about 2 hours ago.
Excellent. Based on what you've told me, I'd recommend acetaminophen, also known as Tylenol. Since you have high blood pressure, I want to avoid recommending ibuprofen or naproxen because they can sometimes affect blood pressure control.
Oh, I didn't know that. I was actually thinking about getting ibuprofen.
I'm glad you asked me first. Acetaminophen is a safer choice for you. You can take 500 to 1,000 milligrams every 4 to 6 hours as needed, but don't exceed 3,000 milligrams in 24 hours.
Okay, so how many pills is that?
If you get the regular strength, which is 325 milligrams per tablet, you can take 1 to 2 tablets every 4 to 6 hours. The extra strength is 500 milligrams, so you'd take 1 to 2 of those as well, depending on your pain level.
I see. Should I take it with food?
Acetaminophen can be taken with or without food, but since you've already eaten, you can take it right away. Make sure to drink a full glass of water with it.
Great. And what if the headache doesn't go away?
Good question. If the headache persists for more than 3 days, gets worse, or if you develop a fever, stiff neck, vision changes, or confusion, you should see your doctor right away. Those could be signs of something more serious.
Okay, I'll watch out for those symptoms.
Also, try to drink plenty of water today. Sometimes dehydration can cause headaches, and if you can, rest in a quiet, dark room for a little while.
That's really helpful advice. Thank you so much.
You're very welcome. I hope you feel better soon. If the pain doesn't improve or you have any concerns, don't hesitate to come back or call us.
Okay, so Johnny, that was excellent. You asked all the right questions before making a recommendation.
Thanks, I learned from the best. But seriously, why is it so important to ask all those questions? Why can't we just say, here, take this?
Because we need to ensure the medication is safe and appropriate for that specific person. Asking about medical conditions, current medications, and allergies prevents dangerous drug interactions or contraindications.
Right, and I noticed you had high blood pressure in that scenario, which completely changed my recommendation.
Exactly. If you hadn't asked and I had taken ibuprofen, it could have affected my blood pressure. That's why pharmacists are healthcare professionals. We're not just selling products, we're providing clinical guidance.
And I also explained not just what to take, but how to take it and when to seek medical attention.
That's comprehensive care. We're teaching patients to be informed consumers and to recognize warning signs. It's all about patient safety and empowerment.
Wow, Sarah, we've covered so much ground today. We've talked about greeting customers, explaining medication instructions, handling insurance issues, counseling on over-the-counter medications, and dealing with difficult situations.
We really have, and these are truly essential conversations that happen every single day in pharmacies around the world. Whether you're studying to be a pharmacist, working as a pharmacy technician, or just want to improve your medical English, these dialogues are incredibly valuable.
Absolutely. And for our viewers, I want to emphasize a few key takeaways. First, always be patient and empathetic. Healthcare can be stressful for patients, and your kindness can make a huge difference in their experience.
Second, communication is about clarity and safety. When explaining medications, be specific, check for understanding, and always invite questions. Never assume someone knows what you're talking about.
Third, be a problem solver. Whether it's an insurance issue, a medication question, or a customer complaint, always look for ways to help rather than just pointing out problems.
And finally, professionalism is key. Even in difficult situations, maintaining your composure and treating everyone with respect is what separates good pharmacists from great ones.
Well said, Sarah. So, everyone watching, we hope this episode has been helpful for you. If you learned something new today, please give us a thumbs up, subscribe to Native Speakers channel, and hit that notification bell so you don't miss our future videos.
And if you have any questions or topics you'd like us to cover in future episodes, leave them in the comments below. We love hearing from you.
Thanks so much for watching, everyone. Until next time, keep practicing your English, stay curious, and remember, communication is the key to success.
See you in the next video.
Bye, everyone.